Hello, this is Emma Hitt Nichols, and this is the information on the latest US FDA approvals for the week of July 17th through the 21st last week. Please subscribe, rate, and review this podcast. Much appreciated. Thank you. The FDA has approved Vanflyta, also called quizartinib, for adult patients with newly diagnosed acute myeloid leukemia, AML, that's positive for the FLT3 internal tandem duplication, or ITD mutation. Overall, FLT3 mutations affect about 1/4 of patients with the AML, and there are two types of FLT3 mutation. FLT3-ITD, which is targeted by Vanflyta, involves multiple copies of the gene in a row, and then FLT3-TKD, tyrosine kinase domain, the other kind of mutation, involves a single change or gene deletion. FLT3-ITD mutations are more common than TKD mutations in patients with AML and are associated with a higher risk of relapse and worse overall prognosis. Last week's approval of Vanflyta comes with the approval of a companion diagnostic. Vanflyta is indicated for use in combination with standard cytarabine and anthracycline induction and also cytarabine consolidation, as well as maintenance monotherapy following consolidation chemotherapy. The approval of Vanflyta was granted to Daiichi Sankyo on the basis of data from the phase 3 Quantum First trial, which showed an improved overall survival with the addition of Vanflyta. The trial also included older patients up to 75 years of age who were fit for intensive chemotherapy. Along with Novartis's Rydapt, which is also called midostaurin, and Astellas Pharma's Xospata, also called quizartinib, Vanflyta becomes the third drug now available to treat FLT3-positive AML. Also last week, the FDA approved AstraZeneca's long-acting anti-RSV monoclonal antibody, Beyfortus, also called nirsevimab, for the prevention of respiratory syncytial virus, RSV, lower respiratory tract disease in neonates and infants born during or entering their first RSV season. It's also approved for children up to 24 months of age who remain vulnerable to severe RSV disease through their second RSV season. RSV is the leading cause of hospitalization in infants under 12 months. Almost all infants are infected with RSV by their second birthday. Premature infants and those with chronic lung disease of prematurity or significant congenital heart disease are at highest risk for severe RSV disease. Beyfortus is administered as a single dose timed to the RSV season. The safety and efficacy of Beyfortus were supported by data from 3 clinical trials, including the MELODY and MEDLEY trials. Beyfortus was given a fast-track designation, and an FDA panel voted in favor of Beyfortus for RSV disease in June of this year. Use of Beyfortus still needs to be formalized by the CDC's Advisory Committee on Immunization Practices, or ACIP. Their next meeting takes place soon, on August 3rd. Beyfortus will become the second antibody available to protect young children against RSV. The other is Synagis, also called palivizumab, which is manufactured by the Swedish company Sobi, and that's indicated only in infants born prematurely and who are younger than 6 months. Also last week, the FDA has approved CyfendusTM, which is Anthrax Vaccine Adsorbed and adjuvanted, given in conjunction with antibacterial drugs for post-exposure prophylaxis following suspected or confirmed exposure to Bacillus anthracis. That's the bacterium that causes anthrax in adults aged 18 through 65 years of age. Clinical trials showed that 2/3 of participants who received CyfendusTM achieved the primary endpoint, which is the result from a vaccine-induced toxin neutralization assay at day 64. CyfendusTM is given as a series of 2 doses, 2 weeks apart. One other vaccine is available for protection against anthrax. That's called Biothrax, and that's been approved since 1970, and that's given in a series of 5 doses. Both vaccines are manufactured by Emergent Biosolutions. In clinical trials, CyfendusTM was found to be non-inferior to Biothrax. Anthrax, as some of us can recall from events in 2001, is a potentially deadly infectious disease. The bacteria most commonly affect hoofed animals, such as goats, but people who come into contact with the spores can also become infected. Unless it's treated, inhalation anthrax can be fatal in up to 90% of cases. Before today's approval, Cyfendus was being used under a pre-emergency use authorization since 2019. Also last week, the FDA has approved Ycanth, that's Ycanth. The generic name for that is cantharidin, and that's a topical solution, 0.7% for the treatment of Molluscum Contagiosum in adult and pediatric patients 2 years of age and older. The approval of Ycanth, which will be sold with an approved device for applying the product, was granted to Verrica Pharmaceuticals, and that's the first FDA approval for that company. Approval is based on positive results from 2 identical phase 3 placebo-controlled randomized trials, that's CAMP 1 and CAMP 2, including over 500 patients. No serious adverse reactions were reported, but local skin reactions were observed in 97% of patients and included vesiculation, pruritus, pain, discoloration, and erythema. Molluscum is a highly contagious viral skin disease that affects approximately 6 million people each year in the United States, with the incidence decreasing with age. Mostly affects children and adolescents. Molluscum is caused by a pox virus and results in raised pink-colored lesions that can cause itching and bacterial infection. Without treatment, molluscum can last for an average of 13 months, but in some cases up to several years. Cantharidin has been available to dermatologists through a variety of compounding sources for years, but until now, no FDA-approved standardized product has been available. All right, that's it for this week. Please do check back every Monday morning for last week's approvals so you can stay up to date, and please do tell your colleagues. Thanks so much. This podcast is brought to you by Nascent Medical. If you're a project manager at a CME or medical communications agency and need on-call medical writing assistance, please visit us at Nascent Medical, nascentmc.com. We're a team of MD and PhD level medical writers, and we can create slide decks, white papers, ad board summaries, manuscripts, needs assessments, and much, much more in any medical area. We also do medical editing using AMA style and also fact checking. Visit us at nascentmc.com. And if you're a medical writer and you want to quickly look something up from this podcast, it's really easy. You can go to our podcast page at nascentmc.com, and there's now a search bar which will pull up the search notes from this podcast. So you can type in something like diabetes, and it'll bring up all the diabetes-related agents that have been approved since May 15th when this podcast started. So it's a really great way of searching without bringing in the whole Google search to bear on the information. So definitely check that out. I think it's really useful for medical writers, especially when we're writing, needs assessments and things like that. We're also including the prescribing information with each summary too, to make it very convenient and easy to research agents further. Well, have a wonderful week, and I will talk to you next Monday. Take care.